Thank you so much for having me today. My name is Jessie Bernstein-Newton. I am a licensed massage therapist and board certified in therapeutic massage and body work. I've been doing oncology massage for many years and have had a plethora of experience working with all types of different cancers, different stages, and folks of all different backgrounds. And I think it's a really great um, topic, an important topic that both patients and their caregivers, their family and supporters are aware of the benefits of oncology massage, and also how it differs from your traditional spa-like massage that we see in the movies and on television shows, and that many folks have experienced themselves. And so, with that, we're going to dive into how is oncology massage different than regular massages. Well, the most important obvious, well, maybe not so obvious to many folks, is the training that comes with understanding oncology, pathology, what's involved with treatments, what's involved with um, contraindications, the benefits, the stigmas that's associated with touch during cancer treatment and with the diagnoses. So with oncology massage, it's really important that folks find someone who has specialized training. And what differs from traditional education and oncology massage is that it's an extra form of training that massage therapists go through in order to ensure the safety as well as the quality of the session for their clients. And so with that, not only do we need to understand what exactly cancer is, but also to kind of understand what the experiences are that differ from cancer to cancer, as well as the different treatment options that are available for folks, and to be also able to better understand how to support someone who is newly diagnosed and those that may be experiencing end of life support palliative care. And so all of that encompasses what oncology massage is about. And we're understanding, not quite yet. We're also understanding the dwellings of metastatic disease. We're understanding what myths have existed for years. The stigma that massage itself spreads cancer. And so there are still massage therapists that practice with that old notion, and research has proven otherwise. And that goes with saying that why having someone who is trained specifically in oncology massage is very beneficial, as well as ensuring the safety of the client, making sure that we don't cause more harm to someone who is in active treatment, whether it be chemo, radiation, immunotherapies, having had surgeries. These are all really important qualities that a massage therapist needs to be aware of, that specializes in this field. And as well as understanding how to make different modifications, how to adjust pressure. These are all things that not a lot of non-oncology massage trained massage therapists aren't going to think about. And one of the biggest probably examples that I can reference is I've ended up seeing clients over the years who have gone to therapists without oncology training and ended up receiving hot stone massages. And what ended up happening is that the ramification ended up being a case of lymphedema as a result of that. And so had that massage therapist been trained, they would have been aware not to use hot stones during their session. And so we really have to think about the big picture of the extra education and how this caters specifically to the individual who is experiencing a cancer diagnosis. So with that being said, let's dive into the benefits of how this can impact those dealing with lung cancer. And so the number one benefit that I think massage in general supports is it can restore human connection through touch. And especially in the time period of the pandemic where, folks are not necessarily hugging or touching as much as we did prior, we know that cancer treatment and appointments are a constant form of trauma. It's invasive poking and prodding. There's lack of consent as far as touch goes. We don't often, as care providers, think about I'm speaking in general terms, thinking about that there are all of these things that we're doing. Um, are they invasive or are they connective? And oftentimes it is very invasive, especially if you're having constant blood draws, if you're going for chemo or radiation. It's nothing is enjoyable and relaxing during any of this. So massage itself can actually restore a form of human connection. It's a form of almost a sense of balance of touch. And research has been very I would just say it's been more prevalent that we're hearing, especially during the pandemic, the need for touch. And especially I find that for cancer patients themselves, you need something that is a nurturing connection versus an invasive, aggressive, something that's resistive. And so we can restore calm, peace, and all of that that connects to beings. And so the next piece is increases range of motion. So when we talk about increasing range of motion for lung cancer patients, we're thinking about for those that have had surgeries, whether you've had lobectomies, pneumonectomies, if you've had resections, there's a lot of tension that builds up and restrictive movement. And so with that, we're thinking about working with the scar tissue from those surgeries. And so there's a lot of different modalities and techniques that can be done gently enough for those having had chest surgeries. And so we're thinking of when we have any type of surgery that's here, we're also thinking about the neck, the upper back, and the shoulder restrictions in mobility. And so massage can actually help to stretch the tissues, open things up, allow for more mobility and range of motion. And we're definitely honing in on the scar tissue from the surgeries. It's a slow process. So I always try to encourage people to be patient when they are seeking a massage specifically for increasing range of motion from the surgical perspective, as well as even from radiation, which can cause scar tissue to build up. And so we really approach the session from a slow, minuscule perspective. So less is more. It's not going to be the typical deep tissue, drop an elbow, drop the thumbs and the fingers all in there to try to like stretch the tissue as one might be used to prior to cancer treatment. And so myofascial technique is probably one of the biggest forms of support for working the scar tissue and helping with actual movement, stretching as well, working with the scars that may be residing post-op. And radiation, even if it's from chemoradiation, the combination, we can still support that. Folks might be more tender if they are still in active radiation treatment. So it's all about timing. And so we're working with that as a part of our training. We're also working with how to best support clients as they are going through post-op recovery, and even in conjunction with physical therapy, as some do post-op. So a massage can complement that type of support for the scar tissue and increase in range of motion. Okay, and then stress, our next benefit. Who doesn't benefit from a good massage for stress relief? And so for massage itself, we are definitely supporting our cortisol and serotonin levels. We're boosting our parasympathetic response to help the system kind of decompress and not be in fight or flight mode. And with all of the appointments, with all of the long hours of treatments, or just the anxieties and the stress that go along with the cancer diagnoses, kind of like we talk about in the benefit of restorative human connection, the massage can give a bit of respite from the world of chaos that a cancer patient is going through. And so for an hour, for 30 minutes, even if it's for 15 minutes, if we can kind of help decompress the system and support the nervous system to kind of just be, we can definitely have a lasting effect, because that also affects the other benefits that oncology massage has. And we're going to touch base on this in just a moment or so, but if we're working on the stress, if our stress levels are down, we can also affect the stress levels of those that are helping to care for us because they see the effect of the cancer patient being decreased as well. Hope that makes sense. All right, so let's talk about decreasing pain. This is probably the number one question that I often get, especially for people who have had surgery or radiation, or even just general procedures that are done, biopsies and all of that that goes with a diagnosis, and continual maintenance care and follow up. So pain is such a fascinating subject, and we could probably talk all day long and hours and days and months about the subject of pain. But when we can decompress the stress levels that a person is going through, if we can work on the scar tissue that may be stuck and restrictive of motion, movement, we can actually help support the pain. There's different pressure points that can also be done through various modalities, such as acupressure, in conjunction with a typical massage session that might be integrated. And there's a lot of research that has been done and continues to be done on the efficacy of oncology massage and on pain management. And what's really fascinating is there are many cancer centers across the US that are actually integrating massage therapy in with their complementary modality support for cancer care in general. And I think we're going to see more of that as the research continues to be abundant with proving the efficacy. And we're going to touch a little bit more on that as far as how caregivers and partners and family and friends can be supportive of decreasing the pain receptors for that. And for the pain, I also want to touch on, so if folks have peripheral neuropathy as a result of the treatment, there are studies as well as I have seen directly with my client that we've been able to support the peripheral neuropathy. Clearly, we can't make it all go away, but if we can support the person and decrease some of the intensity of the neuropathy, then we've definitely enhanced the quality of life of the cancer patient. And then last but not least, of course, there's many benefits to oncology massage, and specifically for lung cancer patients, is massage can definitely benefit the anxiety. So we talk about the decrease of stress, and we talk about restoring human connection, and we talk about decreasing pain. All of this builds up anxiety. And when we can time the session accordingly, so for myself in my practice, if I have clients who are dealing with a lot of anxiety, we will time their session specifically around appointments and treatments to help decrease some of that anxiety prior to the appointments or whatever their appointment might be for. And it really does help. And I find that, especially for clients who struggle with breathing, respiration, maybe they're on oxygen, I find that when we can time when things might be heightened as a result of appointments and treatments, that we can actually help make expansion a little bit easier. And when we can reduce the anxiety, we can have a little bit easier of a time with supportive devices as well. Again, if you have any questions about that, drop them in the chats as well. So let's talk about the one thing that not a lot of people associate with lung cancer treatments and patients is the lymphedema risk. And so lymphedema is not exactly a party to be enjoyed, but lymphedema is something that is manageable. And the way that lymphedema takes place is for when folks have surgery or radiation directly to that involves the lymph nodes within the lung system, there is an increased chance of swelling. And usually for folks who have had lymph nodes removed or radiation directly to the lymph nodes in the chest, lymphedema is prevalent in the hands and in the feet of those systems. And so we do need to be careful as body workers that we're not overtaxing the system, because if we overtax and we over compress the system and the lymph fluid is trying to move where there has been an lymph node involvement, whether it's been removed or radiated, it can cause a bottleneck of fluid. And so what then happens is then we have an decreased quality of life, because now we're dealing with swelling in the hands and in the feet and possibly also in the extremities. So with an oncology massage therapist, when we are reviewing your chart and we're having these conversations, we're reviewing the risk of lymphedema for the individual that arrives. And so with that, there's modified techniques, and we're being cautious of the amount of pressure, the direction of the stroke, how we're applying the pressure as well. Even if we're doing direct work here, we still have to be cautious of the direction that we're moving and the intensity of how we're doing the strokes for said patients and clients. So let's go ahead and talk about more of the contraindications. So whoops, I think there's, oh wait, did I mess it up? There should be a slide right after. Oh, I think we're missing okay. Okay, well, I will insert this piece because according to my list, there is something that we're going to talk about which ties into the lymphedema. So when someone comes in with a history of cancer, whether newly diagnosed or going through it or even post-treatment, they're in remission, we are thinking about all of the contraindications that we're possibly dealing with. And so lymphedema being one, and it's not to say that these contraindications rule you out for a massage entirely. It's about how do we make the session safe for you, and that it's going to enhance quality of life, not diminish the quality for what you came in prior to the session. And so for some of these contraindications, we're talking about fatigue. So when someone says that, they're really exhausting from radiation or chemo or just general compassion fatigue, going through all of this, we want to make sure that we address the session so that we're not overexhausting them. So for my clients, if I have a constant client who is dealing with a lot of fatigue, I might actually consider doing a shorter session that day when they come in. And it's not to say that they're not going to get the same benefit from a full hour-long session versus a 30 or a 50-minute session. It means that we're resetting the intentions of the massage so that we're not overexhausting them. And so when we do a shorter session, I have found with my client that we may actually boost the energy level instead of tanking their energy level. And it's quite fascinating to witness. Not to say that they're going to go out and run a marathon after, but it might be that they're able to have a little bit more clarity to maybe get some chores done, or to be able to get some tasks or work done that maybe they didn't have energy for prior to the session. We talk about surgical sites. So clearly, if someone has an incision on their chest, it will probably be a little bit uncomfortable laying directly face down. So we have to think about repositioning the person and thinking about, okay, we're going to avoid direct contact here until the incision is fully healed. So that is a contraindication and something that we just need to make modifications for in the correct or in the right amount of timing post-op. We're talking about port placement or PICC lines. So we do have to be cautious. Clearly, we're not going to directly apply pressure to those specific areas. We're going to be cautious of how we approach that. And for a lot of folks that come in with PICC lines, they have fancy bands, or they might have it completely wrapped as to not get tangled in the sheets and whatnot. And so again, we want to be cautious of extra devices that might be attached, including and not limited to any oxygen device. So we don't want to take that off of someone if they are relying on the oxygen support. We just make sure that we have it close to the person that's on the table, and we just want to make sure that they have access to it if it's not something that they need at that moment. And so we already talked about neuropathy. So for neuropathy, we want to be cautious of anybody who is experiencing that in their hands or in their feet, because the lack of sensation or the inability to detect the pressure that's applied. So it's not to say that we won't apply pressure, but it's more of open communication. How is it? And we want to make sure that we're looking, because if they are in pain, if there's as a chemo side effect, if there's any blistering or anything, we want to make sure that we are visibly checking the areas out, as some people can't feel if there is something that is going on in those immediate areas. So it's not to say that we can't work on someone with neuropathy. It's about how we do so. And then skin fragility, your skin changes during treatments, whether it's radiation or chemo. And so we really want to make sure that we're mindful of the skin integrity and being watchful if there's any extra easily scratches or if there's bruises or just the thinning. We want to just be cautious of that when we are working, especially if it's post-op in the area. And then we've talked about pain. So if there is a pain level that is astronomical, uh, and maybe it's a result of the port, maybe it's a result of the radiation, maybe it's a result of bone metastasis. These are all things that we want to be cautious of and figure out ways around so that we're not adding to the pain and the discomfort in those specific areas. And, if there is pain that is not manageable and I'm not able to support the person, then clearly, like, I'm going to make sure that they re-follow up back with their clinician so that they can get the best support possible for that, because pain management is very, very important. Um, Another is if someone is very nauseous, and they might be experiencing vomiting. It's about timing again with the session. Maybe the session isn't the right time, or making sure that maybe we do a shorter session, which might be less intense for the system, and hopefully minimizing some of that nausea for the person who's experiencing it. And shortness of breath. So clearly, if during the session there is an enhanced sign of shortness of breath, or someone comes in and now their breathing has changed immediately prior to the session, this might be an opportunity where we do not see the person and we have them follow back up with their clinician, and making sure that as a massage therapist, I would also make sure that your clinician team, your clinical team, is aware that you are seeing a massage therapist that specializes in oncology massage, because care planning can be very effective, especially making sure that everybody is on the same page for your overall care. All right, so let's go ahead and talk about who does this benefit. And so, as we obviously know, that oncology massage is going to benefit you, the patient, the person who is experiencing all of this. And if we can impact your quality of life in a positive direction, we know that your caregiver is going to be more, or I should say, maybe less anxious, because they see that it's making a positive impact on you. And if you are feeling a little bit better as a result of the oncology massage, your healthcare team is able to have easier access to being able to do the things that they need to do to support you during all of this. Maybe it's communication, maybe it's getting blood draws, maybe it's easier for you to lay on the table while receiving radiation. Maybe it's other healthcare team members that you are experiencing. It just makes your overall general awareness and ability to have clarity during your appointments as well, if we can minimize some of these effects of the cancer and the treatments themselves. And of course, this is going to affect family and friends, especially if they are visiting with you, they are wanting to support you, encouraging them to get you gift certificates to receive bodywork from an oncology trained massage therapist. That is a really great way to have a double support of them supporting you while they feel good about knowing that they did something for you. So it's a good excitement all around for everybody, and it has lasting effects for that. All right, so now that we talked about who does it benefit, let's go ahead and talk about, say you're a caregiver, your family or friends would like to be able to provide support to you. There's a few things that I like to make sure that folks know about before we head into that. So these are the essential things. Setting your intentions. Why is it you want to touch the person that you're caring for? Is it you want to help with pain? Is it you want to help with nausea? Is it you want to help with the anxiety? What is it that you're hoping to achieve by providing any type of touch? And the reason why I'm going over this is because oftentimes I get caregivers will send me messages or they'll call me and they will ask specifically, well, how can I help my loved one while they are navigating all of this? And while as caregivers, families, and friends, we can't necessarily fix what's happening, we can definitely be a supportive assistant to helping you navigate all of this. So we want to set the intentions. We want to pick a location within the home or space that is most comfortable for the recipient as well as the giver. If you, the giver, are not comfortable, you're overarching your back, you're straining, you're going like this, it's not going to be an enjoyable process for you to be able to support your loved one. And so for the person who's receiving, we want to make sure that they are in a place that is comfortable. This can also be done if you're waiting for your doctor's appointment or your treatment in the waiting room. It can be done during treatment while you're actively receiving your chemo. It can be done while you're hanging out at home, while you're laying on the couch in your bed. These are all possible areas that it can be done. Even in the car, a hand massage can be done. Clearly not while driving. The other piece is grab your props. Pillows, blankets, towels are really great things that can be rolled up easily and tucked under different body parts. And we'll see that in the next slide, but we'll touch base on that. But these are extra things that we don't often think about that can be helpful in positioning, especially bath towels. I love towels, hand towels, bath towels, you name it. And then grabbing lubrication. You want to be able to, if you are doing, even if it's just as simple as a hand massage, you want to make sure that you have a lubricant that is minimal, that has minimal ingredients. Lotion, oil, and cream are all great things that you can use, and you can use stuff that you already have around the house. The only oil I would suggest not using is olive oil. It's really thick and it's heavy, and you have to remember that whatever we put on our skin, our system is absorbing. So we want to make sure that, again, it has minimal ingredients for that. And then consider a music playlist. Whatever the recipient finds that's relaxing, gets them in the zone of just being in peace. Those are the things that maybe you want to strum up on your Apple playlist or Spotify music playlist. Let's go ahead and check out some. That's okay.
Sorry, I just wanted to ask a question before we go on. So we talked a little bit about needing to find a trained oncology massage practitioner, but are you saying that a caregiver can actually play that role as well?
They can. And one of the, and I was going to introduce it a little bit later, but I'll introduce it
Okay.
now. No, this is a great question. So back in, I don't know what year it was, forgive me on my history timeline, there was an NIH funded research study that was done through the National Institute of Health, along with the National Cancer Institute, to create an opportunity that could teach caregivers, loved ones, how to provide effective touch to their loved one who is going through cancer treatment. And it was an incredible opportunity. William Collins, he's a psychologist who spearheaded the research study, and the person that I originally trained with my oncology massage, Tracy Walton, along with Carrie Reynolds, had put together this opportunity of effectively going over all the things that we're talking about as far as contraindications, lubrications, location, position. And they created this toolkit that is called Touch Caring in Cancer. It might be backwards on the screen, but it is a DVD set. And what it does is it goes through, there's a booklet that comes with it, and it goes through effectively different body areas, the risk of lymphedema, how to work and understand the system, contraindications. There's a precautions checklist, and it's a really great effective tool for folks to have. And if you don't have access to watching the DVD, which is actually in 5 different languages, the book complements the DVD. So you can take it anywhere and be able to follow step by step the instructions. Yeah. So let's talk about the possible positions that if you are doing this at home, I'm not going to spend too much time because of the timing, but I just wanted to highlight, you can go ahead and click through all of those. We can talk about being on the couch. As previously mentioned, you can lay on your side. You can see that there are assistive positions using the use of pillows. You can see laying face up, having a lot of pillows underneath the knees, behind the head and the back. If you're on the bed, and go ahead and click one more. And then there's positions on the bed. So if someone wants to lay on their bed and the person wants their back, you can either lay have the person lay with their head at the foot of the bed or even at the top of the bed, and you can get on top of the bed with them and be able to provide the support, as well as laying, sitting in a chair. Clearly, if it's comfortable, as you can see, my model here has a pillow propped in front for extra cushioning and support. So go ahead, next. And so while I'm not going to dive all into how to do, just these are simple techniques that we can provide. You can go ahead and click through. There's the claw. You can simply see the thumbs are on top and the fingers are underneath the hand, and doing gentle strokes like this. Supportive glide is literally just gliding the hand. It's not a whole lot of pressure. It's very gentle. It's just a lotioning pressure. And then a gentle coin rub. Go ahead and hit the next slide. And for the back, these are simple strokes that can be done. And the reason why I say they are simple, because we are talking about nothing is fancy and you do not need to do all of these. The lobster claw is just gentle compressions at the top of the shoulders. The long broad strokes are straight from the lower back of the lower part of the back and straight up. And then we have broad stretches, taking our thumbs together, our palms together, and just going out from the back. And then we also have the short broad strokes, just doing broad strokes like this instead of the whole length of the back. Maybe you go from the lower back up to the middle, and then you can go from the middle up to the top. And then the very last part is circles, broad strokes. And I say broad because we don't want short mini. We want nice and broad like this. Go ahead and hit next. And so here are a few important reminders if you are providing this as a support for your caregiver. Grounding yourself is important, making sure that you are centered before you enter that space, because they will pick up on the energy. If you are all over the place, that will convey through the touch. Check in consistently on the comfort level and the pressure and the speed. And this is something you can actually do. Caregivers and partners and family members often want something that they can actually do to help. This is something that is very empowering for everyone. And as we talked about, it can be done in any location. And if all you do is hold hands with your loved one, that is making a significant difference. Go ahead and hit next. And questions to ask your massage therapist is you want to ask about their specific trainings. What did they do to learn about oncology massage? Did they take just a 3-hour class that just gave them the basics of the ins and outs? Did they take a full-on oncology trained continuing education? And so there's an organization, which the information at the end of the slide, at the end of the slideshow, called Society for Oncology Massage, which I am a preferred provider through. And they have set the standards of what oncology massage training should look like, with a minimum of 24 hours of basic, advanced, it's not basic, but it's an advanced training, because this is going to cover so much more than what we talked about, but the hows, the ins and the outs, and all the questions that us as providers should be asking our client and reviewing in their intake. You want to ask them, what do they know about lymphedema? This is a really, really important one, especially for those who have experienced lung cancer. We want to make sure that we keep that risk down and minimal. And then what modifications will you make for me? Again, we're talking about if you've had surgeries, if you've had radiation, if you have a port, if you have bone metastasis, if you have limited range of motion, if you're nauseous. What are the things that they're going to do to make sure that your session is enhancing quality? And I reference that statement quite often, is our responsibility is to enhance quality, not diminish it. Go ahead and hit next. And then these are the resources and how you can find a massage therapist that is oncology trained. And while not every oncology massage therapist is a preferred provider through the Society for Oncology Massage, these are all three of these are really great resources to be able to find. And they have a search, a find a massage therapist locator, and you can type in oncology massage and you should get a list in your area for those that provide this. And then you can ask them. They may have it on their website, or you may want to call or email and send them a message to ask these specific questions. Thank you so much, and I really appreciate this. What questions do you have, if any?
This time I'm not seeing questions in the chat, but people can feel free to add their questions in the chat and we'll answer them.
I have a question. How can people who are doing massage at home reduce the risk of lymphedema?
So with that, you're going to really avoid probably those areas, especially if there is an increased risk. You probably will avoid doing direct work on the arms and the hands, or you can modify. And so the modified strokes are, it almost feels like a feathering stroke, but it's not. It's very, very light pressure. And when we do those strokes, we're avoiding going in the direction of where the lymph nodes are. So we reroute and go away from those areas. But if someone is very apprehensive about it, I usually tell them to ask a professional to walk them through what that looks like, whether it be a physical therapist or an oncology trained massage therapist. And sometimes even the nurses at the clinics will be able to provide that information. But this resource, Touch Caring in Cancer, does definitely provide the how-tos and how to make sure that you're making it safe for you as well.
Mm-hmm. Can you just take maybe a minute and lead us through like a self massage kind of like on the hand or something like that to work on some techniques?
Sure. So one of the things that I often, people are like, wait, I can massage myself. Like, yeah. And so one of the things I am going to start this off with is I'm going to show you a pressure point that you can do. I'm going to show you 2 pressure points that are really helpful. And these are acupressure that falls within the massage modalities. Let me adjust my screen here. Okay. So you'll take your hand, and what you're going to do is take your other hand and you're going to take 3 fingers, and in the space between where the tendon of the arm is and the bone that is right here along the arm, you're going to take 3 fingers. You start at the wrist, just like this, and where that 3rd finger is, you're going to place your thumb. This is a pressure point that is really good for nausea. You can do this on yourself, or someone can do it for you. I find that this is really helpful for people who have a lot of nausea, whether it's from the medicine or stress related. This is something that can be really helpful. So when you do hold the point, you can you can hold the arm in your lap, have it hanging down, and just support your hand like so, and just kind of relax and breathe really slowly through the point. And it's a little bit of pressure. It's not a whole lot of pressure, but it's also not a feathering pressure. You want to be able to feel it. And for some people, they feel it within seconds, and some people it can take maybe 15 minutes or so to feel the effects of that. And then the other pressure point that I'm going to show you is for pain. It's called large intestine 4. We are using the web of the hand, and we take our pinchers, our index finger and our thumb, and we're going to have our thumb is going to be on top, and then our index finger is underneath, and then we push the thumb in like so, and this helps with pain. It's really good for helping with headaches. So headaches as a result of lack of sleep or as a side effect, this is really, really helpful. And again, this is something that you can do on yourself or somebody else can do for you. And the other thing that I would say to me that would be of helpful to yourself is just general arm strokes, just going up the arm like so. This can be really soothing, even for oneself. Sometimes we often find ourselves doing this without even realizing it. And it's not a whole lot of pressure. It's just, it's again, a lotioning stroke, just going directly straight up the arm, just like that. And oh, I guess I'll show you one more, just because it's my favorite one to show. If you wear glasses, you're going to take them off. And a lot of times we have stress that's up here. So something that is really helpful, we take the palms of our hands, place it at the ridge right here. If you have oxygen on, you'll just make sure that it's not going to get in the way. You can tuck your thumbs underneath the tube and just go straight down and relax the jaw. And it'll help to release a lot of this tension, which can also affect the neck tension as well.
Super. I loved that. Michelle, are there any questions in the chat?
At this time, there are no questions in the chat.
Well, Jessie, if people have questions, can they email you at the email address on the screen?
Absolutely, and I totally welcome the questions, and I'm also more than willing and welcoming you to ask if you need support in finding a massage therapist in your area as well.
Great. And then I think that I had maybe one more slide, but there we go. Okay, so this is just to round this out with a few resources from the American Lung Association. The recording of this, when it's available, will be at lung.org/patient-meetup. This is part of our patient meetup on the go series, where we're trying to offer some webinars that people can watch whenever they have the time that's convenient to them. So when we have more webinars listed, you can go to this site to sign up for them, and then you'll also be able to find the recordings. We also have a variety of support resources. We have our mentorship program. We have our lung cancer survivors group on Inspire that you can find at lung.org/community. We have our helpline. And then if you're looking for any lung cancer information, lung.org/lung-cancer is the place to be. So we're here for you, and I just wanted to thank Jessie for her time today. This was wonderful, and we hope everyone has a wonderful rest of their day.